Thank you so much, Mr. Tippoo, for this very brilliant and deep insight. And I would like to pick on you later on the fact that you were very conclusive about the debate being over with respect to local manufacturing of vaccines on the continent. While there are still so many debates ongoing, but we would like to hear more on this proposed way forward that you have mentioned, deeper engagement of government and investment in technology and capacities, and also solve the market demand certainty. So these are things that we would like to be discussing as we move forward to the panel discussion in general. So thank you very much, gentlemen, for Marie, for this insightful contribution. So the first question I have, I would like to start with Mr. Tippoo to continue from where he has stopped. Is as we address some of these challenges we've mentioned with respect to cold chain and other challenges of delivery of vaccines to the last mile with respect to COVID-19, how will these solutions that we're bringing forward cascade to other products and improve supplies to the last mile?
Yeah, so again, I'm going to use the question to bring focus to the current paradigm that we live with respect to vaccine production and vaccine production capacity. That now we are scuttling around because of a very urgent need to get vaccines to where they are required as fast as possible. The reality is that when you look at where this has been achieved, there are many factors that obviously come into play, but one of the key things that one notices is that countries in which there has been capacity historically for many decades to produce routine vaccines had the ability to repurpose facilities and repurpose production lines and direct them to COVID-19 vaccine production almost overnight. It didn't happen overnight, but within a remarkably short time, as we've all experienced. And at first, many of us didn't believe that it could be done so fast, but thankfully, new precedents have been set in terms of the speed. But the point here is that the ability to respond in a pandemic rests on the capacity to produce routine vaccines, and that acts as a springboard then that when a pandemic comes around, one is able to then respond to that. And I think that this relationship between pandemic readiness and routine vaccine production, together with the upstream side of it, the supply chain issues, as well as the programmatic side of the delivery end of it, needs to be key factors which we need to concentrate on.
Thank you very much, Mr. Tippoo, for those responses. And to get a practical perspective to this, what has been said so far, I would love to hear from Mr. Rodrigo how all these that have been discussed, solutions that have been preferred to address these challenges, could be of practical usefulness on the ground in the context of Brazil, in terms of addressing or cascading effects to other products, as it may be, with respect to medical products. Mr. Rodrigo.
Thank you, Doctor. The fact is, it is a big challenge. 15 days ago, we started our influenza vaccination program, and so we have to adjust these vaccination campaigns, taking into account the one that's already underway for COVID-19. So it is indeed a big change. We need to guide the population about this, in addition to all of the matters that have been raised here about infrastructure, the need to adapt our infrastructure for the production of COVID-19 vaccines. We have 2 large labs in our country that refit their infrastructure for that production. We have one in São Paulo, Butantan, and that is also the one that produces vaccines against the flu virus. And that was a campaign we started 15 days ago. We also have Cruz Institute, which is producing the AstraZeneca vaccine. And we're engaged in this technology transfer process where we hope that this year the Cruz Institute will start producing the COVID-19 vaccine, 180 million doses a year would be the rate of production, so that we can meet the whole Latin America demand. With that capacity, we hope that we will be able to help meet the demand throughout Latin America. So we have refit and adapted our infrastructure very quickly, as Patrick said, and we can't stop producing the other vaccines at the same time. That's a challenge. And the other challenge is how to inform our population, because 60% of Brazilians live in the big cities, but 40% of the population of Brazil isn't yet in the urban centers that need access to information. So the challenge, in addition to the infrastructure challenge, we have the challenge of communication. How much time needs to be between being vaccinated for the flu and then for COVID-19? And in addition to all of those challenges about the adapting our infrastructure for production, in addition to that, those countries that are capable of stocking up because they produce the low, that is, those countries that have stocks can help those countries that still have low levels throughout the world. This is a world problem. It needs a world approach. We have to vaccinate our population, but we need to understand that the whole world needs to be immunized, lest the virus undergo mutations and then come back to bite us, even though a given country may have been vaccinated against earlier variants. So we do have this challenge. We have to make these infrastructure adjustments. We know how important it is for us to not stop investing in our national productive complex. We still depend on other countries. And so, as the doctor said, in the long term, we have to have a strong productive infrastructure to help other countries as well.
Thank you very much, Rodrigo, for that response. Mary, how would you respond to this with respect to the knock-on effect that these will have, cascading effect on other medical products?
Yes, so I've been working in pandemic now for a little while. I went in influenza for almost 20 years and in pandemic over the last 5 years. And if there is something which I have come to understand very clearly is that it's all about planning. It was mentioned several times, short to long-term planning. Patrick highlighted the market demand issue, which is really about creating awareness on the burden of disease and also working on the acceptability that the response to a pandemic would be of the quality that is necessary in light of the severity of the pandemic. But everything has to be done normally in inter-pandemic. The investment in manufacturing, the investment in communication, the investment in policy, all these things all these stars have to be aligned prior to a pandemic, so that when there is a declaration of a pandemic, things can roll out the most effectively in the speediest way that's possible. One element that has not been talked about today at the moment is the workforce, the involvement of the workforce. One of the reasons why we believe at Ready to Respond that influenza vaccination program, which come back annually, is really the best exercise that comes annually in order to help the communities, the healthcare workers, the government, the private sector to come together and to be ready, is because it enables people every year to get a retraining, if you want, about the importance of vaccination. The other element which comes with the influenza vaccine program as a good blueprint for pandemic preparedness is the fact, and COVID-19 is showing us that it is the case now, it's focusing primarily in the adult vaccination segment, which unfortunately continues to be uncovered and untapped in low and middle income countries. So if I had the magic button, I would say that one thing that we should do is strengthen preparedness on all these elements inter-pandemic between two pandemics. And we know that the next pandemic is maybe less than 10 years ahead. And the second thing would be really to invest a lot on healthcare workers and frontline workers so that they are ready next time around.
Thank you very much. So most of the answers I needed for my second question have been touched upon by you, the panelists. And this is with respect to how do we ensure capacities of countries around the world are built to produce vaccine. Patrick had mentioned government commitment and, of course, political buying, support to scale, support to create demand certainty at the ground level. You have also just mentioned, Mary, about building human resource capacity. We have heard examples from Brazil about what's already going and the benefits and knock-on effect that this had on other products. And now Patrick, you mentioned the debate is over, but this is coming from you. We've heard from the previous panel about ensuring that we don't spread ourselves too thin in terms of manufacturing so that we could have economy of scale and a lot of other arguments across the divide. What would be your strong justification, Patrick, for having every country being able to produce their own vaccine and distribute their vaccine and the benefits therein?
Yeah, Ben, I think that what we are advocating for is not the production of vaccine in every country. And I think that it is clearly understood that, as you said, that because vaccine production runs on economies of scale, because of the high investment costs, the fixed costs attached to the vaccine manufacturing operations, the only way in which you can make vaccines more cost effective and lower the cost of goods is by producing larger volumes and having large scale facilities. And I think that what we are advocating for here is that it's not one extreme versus another extreme, where now we have the sort of very concentrated capacities at scale in certain geographies. And we're not arguing for the fact that we should move to a case where every country has its own capability. Because I think that what we are saying is that on a regional basis, and there's an argument which the African CDC is leading as well with respect to the program of vaccine manufacturing capacity on the African continent, is that at least there should be some regional capacity. Now, obviously, there are huge and very complicated issues to wrestle with in coming to a determination of what exact capacities ought to be established, what products should these capacities focus on, and what technologies should they rely on. And so this is all part of the mix. But I think the argument is that, I think, twofold. We've seen what has happened with COVID. We've seen, which is a current reality. We've seen in 2009 what happened with the threat of a pandemic flu, that Africa in particular was left behind. And so that is something that I think we need to push through and deliver a solution on the African continent. And one could also argue more generally from an LMIC perspective that needs to be examined in other geographies as well. I think another important point to consider in the mix is that of vaccine hesitancy. And obviously, vaccine hesitancy is fed by multiple factors. But I think that where there is a distrust that, oh, this vaccine comes from outside Africa and there might be an agenda behind this to impact Africa and African communities in negative ways, I think to a measured extent that can be mitigated by the production of those products locally.
Yeah. Thanks very much, Patrick. A good case there. Mari, your response to this?
To the response regarding manufacturing in every country, I would agree with Patrick. I don't think that would be the most effective way of addressing the issues of capacity. From my perspective, the pandemic vaccines, usually it's a government market. It's not a private sector or a hospital or a general practitioner market. It's really those vaccines are invested in and procured by government. And the issue that companies may be facing, and we're speaking, for instance, about COVID-19, is when the pandemic is over, how are we going to continue keeping the volume of manufacturing, the output of these facilities to the extent that it will be cost effective? Because when the COVID-19 will become endemic, if it becomes endemic, the volume, and we do boosters, it's probably going to be lower than during the pandemic. And therefore, those vaccine companies will have to find other markets, and that will create issues around identifying pockets and markets and segments which will be able to take those vaccines in an affordable way. So I think that is a complex issue. We should start with a select group of countries which have the technical skills, the funds, and the ability not to close border, by the way, to allow free flow of shipments and not impose trade barriers between countries. And that would be the way to do it in a sequential manner. But I think we agree that it wouldn't make sense to put a manufacturing site in every country.
Thanks very much, Mari. I think we are getting to a consensus on this. And I will pass it over to Rodrigo, coming from the country level, for his final reflection on this, and based on the experience that's already ongoing in Brazil, and how he sees this moving forward.
Thank you. I would like to thank you for the opportunity to participate. The contributions and the discussion was really rich. A few points I want to underscore from the dialogue and the things that all panelists mentioned. The key message is planning. At least in Brazil, we saw that. We need to plan in 3 large pillars. First, human resources. Dr. Marie talked about that. In Brazil, we were stressed. We needed more specialists in ICU, intensive care doctors from one day to the next. We had to put doctors working in that specialty, and that shows that we have to improve our planning process for human resources, where it is that we want to go, how we want to get there, an important issue. that has to do with planning. The hospital infrastructure, we have to ask, is it enough? Does our hospital infrastructure work efficiently? That's another issue that we have to include in our planning process. And third pillar, and that's what we discussed today, to have a strong industrial complex that will respond quickly and adequately to the pandemic demands that may arise. I agree with the reflections that say that we have to think of centers of production and open borders to overcome the pandemic. All countries have to be humanized. If not, we are subject to new mutations, and we will not be able to end the disease. So those would be my three points in terms of how to plan, how to work on this process for future pandemics. Dr. Marie said that in 10 years, the system will be stressed again. So countries have to plan on human resources, a hospital infrastructure, and industrial complexes. Thank you very much, and I return the floor to our moderator.
Thank you very much, Rodrigo, Mari, and Patrick. Very clear insight into that. And talking about future pandemics, we know this will come. And as you stated, Mari, we're looking at 10 years down the line. COVAX has helped to bridge the challenge of vaccinating in hard-to-reach or low and middle-income countries so far. What do you think are the gaps with respect to how COVAX has functioned today that we could ensure we don't repeat, or we could ensure we fill in the future? Mari.
So, I don't work for COVAX, but from what I've been able to read in the news, I feel that the COVAX is an amazing platform. I think that we didn't have that in 2009, and most of the low and middle income countries received their H1N1 vaccine actually after the end of the pandemic, which was just a shame. And we were all lucky that it was a mild pandemic. So the idea of COVAX was really an amazing idea, and they have done a terrific job in building the platform. One of the things that came in the way was the fact that initially countries started to close their borders, and there were trade constraints. So the flow of materials and the flow of ingredients and that could be put into the system for increasing supply have been really slowed down by all these government decisions, which were kind of selfish decisions. But totally understandable from a point of view of national government. So that potentially would be addressed in preparation of the next pandemic, so that we can anticipate that when COVAX will continue to operate or will come back for the next pandemic, those issues of trade in particular will not get in the way and will allow COVAX really to address the surge need in particularly in diagnostic, in vaccines, and everything else that they've been trying to cover.
Thanks so much, Mari. Patrick, what have we learned? What are the gaps, and what do we need to do for the future?
Yeah. I think that
Patrick, you're breaking up.
The way I understand the COVID is there needs to be. Can you hear me now? Are you able to hear me now?
Okay, better now. Yeah.
Are you able to hear me now?
Yes.
Okay.
Yes,
so from what I understand is that I agree with Mari that COVAX is an amazing facility and that it's an innovative platform, but it needs to. It's dependent. It's dependent on suppliers, manufacturers who can commit certain volumes up front and stick to those volumes. Now, we've learned that it's not only the normal difficulties that manufacturers contend with in living up to their commitments, and that is production goes wrong, challenges along the way, supply chain is interrupted, etc. Those are normal issues that vaccine manufacturers deal with on a day-to-day basis, and things shift and shuffle. But when political decisions are made over these manufacturers in countries like we've seen happen, there's nothing that manufacturers can do about it. Whether those doses are available or not, and the manufacturers are prepared to live up to their commitments, the political decisions are made, and that needs to some mechanism needs to be created to mitigate that. I also understand that COVAX doesn't rely on donations from the manufacturers, so money needs to be secured that will fund these vaccines where and when they are required. And I think that it's been remarkable in terms of the funding that has been secured for COVAX, but I think that's going to be an issue to be refined moving forward as well. I do think that the world was not ready to understand how COVAX actually worked. Countries themselves struggle to understand, but hopefully now that we've been through it, there'll be a more ready and structured response from countries to sign up to the COVAX program if and when a situation like this develops again.
Thank you so much, Patrick. And Rodrigo, I will turn over this question to you and to give us insight on what from your perspective, has been the lessons learned with respect to the COVAX facility, and what you think the gaps are that would help us prepare for the future. Mr. Rodrigo?
Brazil joined the COVAX initiative. They joined to for the purchase of immunization that covered 10% of our population. We received 42 million doses through the COVAX initiative. Of those, 5 million have been delivered, and we will be receiving additional 4 million. It's a very good initiative, and the idea is to regularize and look at all the countries in an equal fashion. Those that need the vaccine the most, that do not have access to the vaccine, should receive those doses. So I want to underscore this initiative. COVAX is really important so that we can equalize the distribution of vaccines to all the countries in the world. And a suggestion to improve the proposal is the countries that are already advanced in the immunization process, that bought the vaccines directly from the manufacturer, should donate to COVAX, so that COVAX, with its global vision, manages to distribute more equally all the doses to the whole world. That would be a suggestion I leave for countries that have already advanced in their coverage, immunization cover, and that they have extras that they donate to COVAX, so that COVAX, that has a multilateral vision, manages to distribute all those doses. And congratulations to all of those who work in COVAX. It's really very important, not only to face the pandemics, but also to equalize the distribution of all the inputs. Thank you.
Thank you so much for that. And I would want to continue on that same line, Mr. Rodrigo, with respect to equalizing the distribution, ensuring equity and reaching the most vulnerable, the hard to reach. You had given an example of how you were able to work in the vaccination program to reach the indigenous population. So we will be going back on that. We know there are different kinds of populations in refugee camps, migrants, rural areas, and really places with low access to health facilities. What would be your recommendation with respect to addressing the needs of this population, ensuring equity, equalizing the distribution to this population? Mr. Rodrigo.
That's a really great challenge, very big challenge, and that I don't have really an answer. We have to make all efforts to reach that population. Brazil faces a very large logistic challenge to access indigenous populations. As I showed, we have to use several transportation methods to get to the indigenous communities, but we get to them. These communities have to be the priority. Just to give you an idea of all the details of the logistics, before we go into the village, to avoid contamination, people who go to perform immunization, they are quarantined, isolated for 14 days to ensure they're not contaminated. Once that it's ensured that they are not contaminated, can they go into the village and do the immunization? And why is it important? Because in Brazil, those populations don't have all the antibodies that us who live in urban centers have. They didn't have contact with many diseases. So it's very important to be extremely careful. So we don't have a ready answer in terms of how to access them, but the motivation is that we should make every effort so that we can reach this population and we can immunize them with human resources, using infrastructure, transportation methods to access those populations.
Thank you very much for that. I will pass over to Mari for her reflections on these as well.
Yes, so I think, we hear a lot about migrant population, farm workers, a little bit around the world. So many population are naturally chasing work and their way of earning a life by going around and helping in farms and making money out of it, little money out of it. So accessing those populations is not easy. And again, not every country around the world has a policy in terms of, I don't know about Brazil, I suspect that you have a policy, Senor Cruz, but I'm not sure that every country around the world has this type of policy. So one piece of advice, again, immunization policies need to be strengthened. It's also probably a problem of planning as well. I'm a little bit of a planning side of things. If we know that there is a certain number of migrant population, farm workers who are going around, and we know if you want the profile of this population, if there are pregnant women, there are children, older workers, that will help significantly maybe not only have policies, but also identify pockets of funding so that those people are addressed properly and are tracked for the purpose of being protected also against an outbreak or a pandemic. So I think the policy issue is a big one.
Thank you. That's well noted. And just to remind us that we are coming to the end, or we have exceeded our time by 3 minutes. So while I'll be handing over the question over to Patrick, I would also request you to just give a final word of wisdom with regards to medical supplies to the last mile. Just a sentence to wrap it up. Then I go around and take the last sentence from each of the panelists, and then we close this session and move to the breakout sessions, which are 3 in number. I'm sure you'll be introduced to that very soon. So Patrick, over to you.
Yeah, so Ben, with due respect, I'm not experienced at all in the programmatic side of things and reaching populations and communities which are hardest to reach. But I think just to say the obvious, and that it is very important, extremely important, that in terms of what we do on the manufacturing side, as well as on the delivery side and the programmatic side, that we need to reach and touch everyone. And that is critically important. With respect to a last word about the situation, I think that we have an opportunity now to change the way we think, to create a new paradigm, given this unprecedented challenge that we have faced globally, continentally on the continent of Africa, and even country by country. And I think that we need to shrug off the old thinking and think out of the box, as they say, but not in a cliched way. And I would certainly like to think that, speaking on behalf of AVMI, that we're going to turn the corner on the African continent, and when the next pandemic comes around, Africa will make its contribution not only to African countries, but to the world in terms of adding to the global supply of vaccines.
Great. Thank you so much. Marie, your last word of wisdom for us.
Yeah, so first of all, I just wanted to applaud Patrick, what AVMI is doing with the African CDC and the African Union. I'm absolutely confident that Africa will step up to the plate for the next pandemic. What I wanted to highlight as a final talking point is, again, the importance of data visibility. I spoke a lot about planning and forecasting, but everybody's talking about supply. But data visibility on the demand side, as Patrick highlighted, is extremely important. Having improvement in data visibility will lend to a more resilient supply chain, in that potential bottlenecks or disruptions will be better anticipated and contingency planned for as key dependencies become clearer. It is important to highlight that extended dependencies are not just the finished vaccine, but also syringes, injectors, vials, PPE, workforce, healthcare workers, frontline workers needed at the site of administration. Insights gained from greater visibility are critical to effective planning and coordination of activities. One last word is about the fact that for this particular population we have been focusing on, I think that we need also to consider looking at safety stocks of those materials, so that those safety stocks are earmarked for this particular population, and so that next time around, this population are prioritized our key population. Thank you.
Thank you so much, Marie. Really deep insight. Rodrigo, the final word of wisdom from you.
Thank you. I would like to thank you for the opportunity to work in this panel with my colleagues. The discussion was very rich, and that allows us to go back to our office, improve our guidelines for public policy in terms of planning, and adapt on terms of human resources, hospital infrastructure, and the industrial complex, adapt our logistics so that's not an obstacle to get the vaccine to the last mile to the population wherever they are. So thank you for this opportunity. It was a very fruitful discussion, and I'm sure that with this discussion we improve in Brazil our public policies to face this pandemic and for future pandemics. Again, thank you, and I would like to leave you with this message. Thank you.
Thank you very much, colleagues and panelists and audience. It was really a pleasure speaking with you, and really appreciative and grateful of the deep insights and reflections on this topic, on the discussion, and looking forward to improving service delivery to the last mile in the future. Thank you very much. So we'll be moving over to the breakout sessions. There are 3 of them, as have been explained previously. Data sharing for improved situational awareness, and the other one is on financing and investment, and the last one is on equity in supply chain. So feel free to choose panels you want to attend, and I'm really looking forward for more reflections on this topic as we move forward. Thank you so much, and have a great deliberation ahead.